Safety is an issue that many people think of when they think of birth. And part of that has to do with how our society now views birth. We want safety for mom and baby. That's really important.
Safety is my top priority.
I don't do home birth because I like to take risks with the lives of mothers and babies. I do home birth because I think that it's safe.
What the woman is thinking when she is concerned about safety. What does safety mean to her?
When I come to a birth, it looks like I'm moving in. I bring my bags, I bring oxygen, I bring Pitocin, I bring appropriate medication.
Traditional midwifery is so safe that here we are.
I'm a midwife. I'm a midwife.
I am a midwife.
I'm a midwife.
I'm a traditional birth attendant.
I am a midwife.
So it's really about belief and your belief systems, and I think we do have a huge cultural barrier for people to really believe that birth can be normal.
In our society, what we see, especially on television, in the media, is the worst case scenario.
If we are so integrated that birth is painful, birth is horrible, you need an epidural to get through it, then you need that epidural to get through it. It's not a choice anymore.
Coming to the realization that her body is safe, secure, her body knows how to work, having faith in that body. And I want that same for her family. I want her family to believe that her body is going to work well.
We have a specific set of tools. We have a specific training that allows us to practice outside of the hospital in a safe and controlled way. And when those tools are exhausted at home, we have the option of going to the hospital and accessing a different set of tools.
Your main role there is to be sure the mother is handling her labor and is feeling good and strong about being able to deal with her labor. Mothers do carry some fear when they go into birth, and even when you've worked with them ahead of time, that element is there, especially the first time. And so it's the midwife's job to ease her mind about it, to be calm and to let her know that this is normal and healthy and positive.
Because you're so close with the women that you work with, you know what issues are going on in their households. You know them. You really know them. Their lifestyle, you know, their spiritual beliefs, and you can speak to those throughout their whole pregnancy and labor, so it makes for a very safe environment, I think.
The fathers, their concern is safety, and my primary concern is safety. So our concern for safety puts us on the exact same team. Without safety, there is no satisfaction in midwifery care. Everyone needs to come out of the other end well cared for and healthy.
So the three big ones that I was trained to look out for would be low heart tones, hemorrhage, and if you have a baby that needs resuscitating. If I feel uncomfortable with heart tones, I am confident and comfortable saying to a mom, you know, I'd rather have this baby in the hospital where we have supportive staff that can be helpful here. Hemorrhage, you know, we carry 3 of the 4 anti-hemorrhagic drugs that they bring in the hospital, and so we have those, and we have hand skills, and we have homeopathics and herbs and other things that we can also use for hemorrhage. As far as a baby that needs to be resuscitated, this is something that we recertify with every 2 years. We practice frequently. The cord around the neck, lots of babies have a cord around the neck. The necklace, it's not a noose.
So I always say what we don't have at home is we don't have an operating room, we don't have a NICU, and we don't have blood transfusion capability. So if we need those things, we need to move over to the hospital. My job is to be looking out for red flags.
It's hard to have traditional midwifery when a lot of people have diabetes or alcoholism or depression because of the social factors of oppression and inequality, violence against women. All of those things are actually what contribute to these unsafe births.
We keep a close eye on what's going on with mom and baby. We listen to what moms are telling us because they know what's happening with their baby. We do, in fact, monitor the baby. We take blood pressures. We do all of the clinical things that help us know that things are within norm. We also trust our intuition because that speaks out far ahead and gives us an idea of something is going on. We may not know what that is, but we tune into that.
As a home birth midwife,
And as a certified professional midwife and a licensed midwife, we are only able to, and justifiably so, take care of women who are low risk.
So if then the statistics show that mortality stats are the same for either group, if you look at low-risk women in the hospital and home birth gals, and complications are much higher in the hospital, you have to come to the conclusion that there are risks to hospital birth.
We do have the skills and the equipment that we need to provide for a safe birth. The individual attention that the midwife gives to the clients and their babies, it's what moms and babies need, it's what families need. And machines can't do that.
There's positives to a home birth, there's negatives to a home birth. The same goes for the hospital. True informed choice is really where we're gonna have to get.
We talk about evidence-based practice. We have the evidence to support the practice.
I am a midwife.
I am a midwife.
I am a traditional midwife.
I am a midwife.
I am a midwife.
I am a midwife.
I'm a home birth midwife.